Okay, I'm Giselle Alford and I'm from Australia, and I've come over here with my dad, Gary Martin. And the reason that we came was because for many years, 4 years, I've had a pterygium growing in my right eye, and the last 2 years it's really been bothering me. And I had done so much research to find a way to get rid of it out of my eye. It was bothering me on a daily basis. It made me very self-conscious, and got to the point where my husband didn't want to hear the word pterygium anymore. He'd had enough. I was always looking at it in the mirror, very embarrassed of it.
It was irritating too.
Yeah, it was very irritating. It would often get red and inflamed, and my children would ask me what's in my eye. So I started doing a lot of research in Australia to find a way to have it removed, and everywhere I looked, and a lot of internet research, I found that it was pretty much the only method they used in Australia. I had to have stitches in my eyes, and it was going to take a long time to heal. And my dad had actually had pterygiums in his eyes when he was 26. He had surgery to have them removed, and he had told me stories of being in hospital for 5 to 6 days, completely bandaged, and it had left me feeling very anxious about going through this procedure.
But plus all the drugs that I had to take.
Yeah.
I took cortisone for about two months,
which affected his health, and so I felt very concerned, and I wanted it gone, but I felt like I didn't have an option, and so I kept researching every day. I was on the internet looking for ways, and over time I just started finding out that in America that they were using this non-stitch method, and that really appealed to me. And then when I started doing some internet research for non-stitch pterygium removal, that's when I found Dr.Gulani, and then I started doing many days on his website, looking through all his testimonials and finding out his exact technique. And I found that not only did he do the no stitch, but he also did an amniotic membrane graft, which appealed to me more because all the people in Australia had told me I had to have, basically the top of my eye would be cut, and that would be stitched into the section where the pterygium had been removed, and it sounded very invasive to me. And so then I contacted the office here. I started writing emails and just asking some questions, and the responses were very quick and very thorough. They answered everything I needed to know, and that's when I just started thinking, I would really like to go to America, and I started talking to Dad about it. But then we were concerned with my finances and being able to afford to come here, because not only was it the surgery, but we had to have flights to get here. So I ended up just doing a bit more research and found that in Australia there was a man who claimed to be the best pterygium surgeon in Australia, and he also lived within 2 hours from us, so it wasn't too far. So I actually eventually went to see him just to be sure I was making the right decision, and he was the most rude and arrogant man I've ever come across. He was so horrible, and any questions I had he was not willing to answer, and he basically made me feel like I had no idea what I was talking about. And I actually left there very emotionally upset, because I felt like he didn't give me any answers for what I wanted, and he really actually insulted me, because when I asked about why he didn't use the amniotic membrane or the no stitches, he got very offended. And so I left there just feeling like my only option was to come here, and I believe that was meant to be, because I know now that I was supposed to come here because of other things that happened when we arrived.
Well, from when we left home.
Yeah, from when we left home, everything just went right for us. We got upgraded. We had economy seats on the plane, and we got upgraded to business class. And then even when we got to get our hire car, we had organised a Toyota Corolla, and then we got upgraded to a sports car. Just things went really, really well, and I just thought, you know, this is meant to be. I'm meant to be here. And then when I saw Dr. Gulani for the first consultation, he was just the most lovely man, and he discovered, which I'd known for many, many years, that my left eye was actually very, very weak, and it had always been a problem for me. And for many years I'd been putting up with it turning in, so when I looked at something close, even to cut my children's fingernails on my own, my left eye would turn in, so I'd see double, and I struggled with this on a daily basis. It was a big problem for me. This
was since you were a very young girl?
Yeah, right since...
And we'd seen a lot of doctors about this over the years and never resolved it.
I've been to many specialists, to ophthalmologists, to optometrists, and all of them had told me that because it wasn't fixed before the age of 7 or 8 years old, that was something I was going to have to live with for the rest of my life. And I was just told that I would have to wear glasses, and that the glasses would just get stronger as I got older. And I always had this fear that eventually my eye's going to be stuck turning in permanently to the left. And I was just very... Yeah, it always bothered me, but I felt there was nothing I could do. It was just one of my defects, and that was just what I had to live with.
And the vision in that eye was what, about 20/90?
Yeah, very, very low vision in that eye. So my right eye's always done all the work, and I got used to that. I got very used to that. But then Dr. Gulani, he talked to me, and he said, he picked it up. I didn't even tell him. He picked up that this eye had problems, and he explained to me everything about that eye without me even telling him anything. And he said to me, have you seen people about this? And I said yes, and I said, they've told me there's nothing I can do. And he looked at me and he said, Giselle, that's wrong. There is something we can do for you. And we got here on a Wednesday, and then he told me that the puzzles all just had fit into place, because Thursday was his special day for surgery, that he could do a procedure on this eye to actually bring my vision back in this eye. And so Thursday I went in and had my procedure for this eye, and then Friday I went and had my pterygium removal on my right eye, and it's all just fitted into place, and it's just been an amazing experience. And I couldn't thank him enough. And
well, we found him to be very caring.
Yeah.
He calls up to make sure we're okay at the hotel. He answers all the questions.
Yeah.
He's very happy, even when even when we were a little bit worried in the first couple of days, and he was very open and willing to answer everything for us.
Yeah, he's been an amazing doctor, and I'm just so glad I've come all this way. And when after the pterygium surgery, the next day, this is the Saturday morning, he came in. He did my surgery on Friday especially because I'd come all the way from Australia, and it's not normally his surgery day. So he came in on his day off on Saturday to check my eye and take off the bandage. And when I looked in the mirror for the first time, it was the first time in 4 years that I had seen white in my eye. It was pure white, and for 4 years it's been red and raised, and you know, there's days where it's looked quite inflamed, yeah, and it was just pure white, and it was such an amazing thing to happen for me. It was just a big relief, because for me it has consumed me, that like every day I think about it, every time I look in the mirror I think, oh, there's my red eye. And yeah, I'm just so grateful, very, very grateful.
And then for the first time in your life you've been able to see from the left eye.
Yes, so actually every day the vision in my left eye is getting stronger and stronger, and I'm actually seeing things in my left eye that I would never have seen before. I actually can read the time, and I can look at my rings and I can see them clear and shiny. And before, if I'd done that, my left eye would have turned in and then I would have seen double, and it was always blurry. If I shut my right eye, everything was blurry. So I'm seeing very clear, and I just, once my eyes are completely 100% back to normal after both these surgeries, I just think it's going to be a whole new world and a whole new experience, just to experience life with vision that I just was completely unaware that I could have. So I'm very grateful. Yeah, so my vision's been very important to me because my occupation is a photographer, and obviously I need my eyes for that. That's very important, and so this is going to make such a big difference to my job. My life in general is going to be so much different. And I also just wanted to sort of mention that the staff here, the whole experience has been amazing. The staff here are incredible, and even I saw Dr. Gulani's wife for my medical before I went into surgery, and she's just also a wonderful person. Just amazes me how incredibly kind the staff are here, and also so caring and considerate for everything. Anytime you ring, they're right there to help you out, and they also ring you over and over to check that you're going okay, and it just makes
you feel perfectly safe.
Yeah, you do. You feel very safe in this situation. And another thing that made a big impact on us was the day that we arrived for my LASIK surgery, or my surgery for my left eye. We met a wonderful lady, Esther, who had actually just come out from her second LASIK procedure, and she was just amazing. She made me feel so confident and comfortable that it was all going to be fine, and she was just overwhelmed with how her life had changed, because she'd been in glasses, for thick glasses, since she was very young, and she was just a new woman. She just described how it was like seeing her children for the first time and her husband for the first time when she got home after her surgery, just to see them through her actual eyes rather than through thick glasses. And she made a big impact on us, and she actually came to see us again today, because we fly back out to Australia tomorrow, and she waited around just to see us again, and she's a very special person. Yeah. And while we were here, we also decided that Dad would get an appointment to see if Dr. Gulani could actually help with his eye problems too.
Yes, I've got 3 problems. I wear these glasses, and I have astigmatism, and what else have I got? I'm long-sighted, and there's another problem as well. And Dr. Gulani has done some testing with me, and he said he can give me a total restoration of my sight, so I'll never need these again. And so yes, I will be coming back here from Australia with my wife, and we'll both get our eyes done over here too. Plus, we're so excited about this place that we're planning to send a lot of people over here. We've got a lot of family members that have got eye problems, and they've never had any resolution to these problems in Australia, so we'll be bringing them over here to Dr. Gulani.
My husband is also, he's been in glasses since he was 6 years old, and he's nearsighted. So when he wakes up in the morning, he fumbles around trying to find his glasses and puts them on, and he's fine, but he's, many years of having to be completely attached to these glasses, and I wouldn't trust him with anyone else now. So I'm planning, when we can raise money, that will bring him back here as soon as possible.
Yes, I have a medical background myself. I'm a naturopathic doctor, and I operate a fairly large health retreat in Australia. It's more of a serious health retreat rather than a spa. People come and stay there for a minimum of 10 days, during which time we address all their health issues. And we refer a lot of our patients on to specialists for treatment to do with all sorts of things. So yeah, I'm looking forward to sending a lot of people from our retreat over here, because we get a lot of people come to us with eyesight problems, and up until now we've never really had an answer for them on where to go, and now we do. So I really thank Dr. Gulani for being here.